Welcome to RadicalWellnessTV.com. This is Laura Lee. I'm a natural health facilitator, and I am here to speak to you about natural health, proactive health things that you can do to be happy, healthy, joyous, and free. We're talking about dual diagnosis, adolescents with co-occurring brain disorders and substance abuse disorders. Dual diagnosis adolescents with co-occurring brain disorders and substance abuse disorders. Adolescents are often referred to treatment for substance abuse, but are not referred to a qualified mental health professional for appropriate diagnosis and treatment of any underlying cause for their drug and alcohol abuse. However, many teens have symptoms of a mood disorder that may in fact lead to self-medicating with street drugs and alcohol. Families and caregivers know how difficult it is to find treatment for an adolescent who abuses drugs or alcohol, but is also diagnosed with a brain disorder, mental illness, i.e. ADHD, depression, or bipolar disorder. Traditionally, programs that treat individuals with brain disorders do not treat individuals with active substance abuse problems. And programs for substance abusers are not geared for people with mental illness. Adolescents are often caught in this treatment or service gap. Is dual diagnosis common? The combination of mental illness and substance abuse is so common that many clinicians now expect to find it. Studies show that more than half of young persons with a substance abuse diagnosis also have a diagnosable mental illness. What causes these disorders? Mental health and addiction counselors increasingly believe that brain disorders and substance abuse disorders are biologically and psychologically based. What kind of treatment works? Families and caregivers may feel angry and blame the adolescent for being foolish and weak-willed. They may feel hurt when their child breaks trust by lying and stealing. But it's important to realize that mental illness and often substance abuse are disorders that the adolescent cannot take control of without professional help. Teens with difficult problems such as concurrent mental illness and substance abuse disorders do not respond to simplistic advice like just say no or snap out of it. Psychotherapy and medications combined with appropriate self-help and other support groups help most, but patients are still highly prone to relapse. Treatment programs designed primarily for substance abusers are not recommended for individuals who have a diagnosed mental illness. Their reliance on confrontation techniques and discouragement of use of appropriate prescription medications tend to compound the problem of individuals with mental illness. These strategies may produce stress levels that make symptoms worse or cause relapse. What is a better approach? Increasingly, the psychiatric and drug counseling communities agree that both disorders must be treated at the same time. Early studies show that when mental illness and substance abuse are treated together, suicide attempts and psychotic episodes decrease rapidly. Since dual-diagnosed clients do not fit well into most traditional 12-step programs, special peer groups based on principles of treating both disorders together should be developed at the community level. Individuals who develop positive social networking have a much better chance of controlling their illness. Healthy recreational activities are extremely important. What's the first step in treatment? The presence of both disorders must be first established by careful assessment. This may be difficult because the symptoms of one disorder can mimic the symptoms of the other. Seek referral to a psychologist or a psychiatrist, or NAMI, N-A-M-I. Is happy to refer families to mental health professionals our members recommend. Once a professional assessment has confirmed a dual diagnosis of mental illness and substance abuse, mental health professionals and family members should work together on strategy for integrating care and motivating the adolescent. So I'm going to go ahead and continue this with what do model programs for treating mental illness and substance abuse look like? Love life and life will love you back. Let's look at our mental illness, mental wellness situation going on because we need to really get ahead of that. So like and share and please make a comment. Bye-bye for now. This is part 1. We'll go to part 2.